Metaphon Therapy teaches metaphonological awareness skills to facilitate the development of a child's phonological system. This approach is completed over 2 phases. The first phase requires the child to actively listen to the therapist. This phase targets teaching the child to classify sounds into their appropriate metaphonological categories. For example, we can ask the child, "Is that a sound we make in the front or the back of the mouth?" In phase 2, the minimal pairs therapy approach is introduced. This involves introducing words to a child that differ only by one phoneme and are from 2 differing sound classes. When selecting target words, choose target words that are stimulable and developmentally appropriate. The authors of this approach, Howell and Dean, suggest this approach is best used for children aged 3.5 to 7 years old. It is especially useful for children who are missing entire sound classes. It works best for moderate to severe phonological impairments. The authors of the approach found it to be effective. However, they acknowledged that the therapy results were tentative, as only 13 subjects were included in the study. More research needs to be conducted on the efficacy of Metaphon therapy. For our treatment, we focused on 3 minimal pairs: bow and show, tip and sip, done and fun were the selected targets. Our child stops fricatives, so we selected targets which contrast the sound classes of stops and fricatives.
So today, we're going to be working on our long and windy sounds like shh, and short stop sounds like p. So that's long and windy, shh, and short stop sounds, p. So Maggie, is the shh a long and windy sound or a short stop sound? Point to where you think it belongs. Good, it's a shh, long and windy sound. What about the p sound? Is that long and windy or a short stop sound? Good. This is a bow. Listen to the first sound, b, in bow. Now point to if that's a long and windy sound or a short stop sound. Yes, it's just a short b sound. Now this is a show. Listen to the first sound in show. Shh. Is that a long windy sound or a short stop sound? Yep, show. Is the block hiding under sip or tip?
Tip.
I heard you say tip, but I don't see a block under tip. Try again.
Sip.
Right, the block is under sip. Let's try that together. Sip.
Sip.
Good job.
Okay, Brooke, so today we're going to be working on 2 different types of sounds. So one type of sound that we're working on, we are producing more airflow in our mouth and the sounds are longer. So when we make those sounds, we're going to do this, okay? So we're going to slide our hand down our arm. We're going to say shh or s or f. And then for the other group of sounds, the sounds that we make will be shorter and we're going to stop the airflow as we say the sounds. So sounds like b or p, we're going to hit the stop sign on the table, okay? So it's one short, quick movement.
Okay.
All right?
Got it. Okay.
So what about the sound shh? Good job. Okay, so now let's think of the sound b. Good job. Okay, Brooke, is the candy under show or bow?
It's under bow.
Okay, I heard you say bow, so we hit the stop on that sound. Let's try it again.
Show.
Good job. So we did a show sound. And guess what? The candy's on there. There you go.
Metaphonological skills are trained to improve the child's cognitive awareness of the differences seen in their sound system. By incorporating the minimal pairs approach, the child is exposed to sound contrasts. In the future, more research should be conducted regarding the efficacy of Metaphon therapy.